Would you know the symptoms that could indicate a stroke? If you or your loved one was having symptoms, would you know how to respond? I'm Lauren Aldy, and this is your Herald Health Minute brought to you by the Cape Regional Health System. Recognizing and reacting quickly to stroke symptoms could make a big difference. Some symptoms are more subtle and some are more obvious, but all need immediate medical attention. A stroke is a medical emergency since blood flow to the brain is altered and cells in the brain aren't getting oxygen. Left untreated, strokes can be severely debilitating, causing paralysis on one side of the body, problems with thinking, learning, judgment and memory, emotional disturbances, or loss of speech or vision. A stroke can also be fatal. A TIA, commonly referred to as a mini-stroke, is just as critical to treat. TIA stands for transient ischemic attack. Transient simply meaning that the symptoms resolve on their own, but medical attention is still needed, especially since TIAs could indicate several risk factors of a stroke. Ischemia means lack of oxygen. Therefore, a TIA is a temporary episode of your brain not receiving proper blood and oxygen, causing the person to be symptomatic, almost identical to a stroke patient. These tend to be precursors to a full-blown stroke. Don't wait to see if your symptoms go away. Call 911 immediately. Symptoms of a stroke or TIA can include sudden numbness, weakness of an arm or leg, difficulty walking or holding an everyday object like a pen or a fork, a severe headache, vision changes, or mumbled speech. People of all ages can have a stroke, not just seniors. A major risk factor is uncontrolled high blood pressure, which affects nearly half of U.S. adults. To lessen your risk of stroke, it also helps to stay active, eat right, and avoid smoking. Medications to treat high blood pressure and other risk factors should be discussed with your doctor. If you're having a stroke, it is critical that you get medical attention right away. Immediate, time-sensitive treatment may minimize the long-term effects of a stroke. This is because several treatment options are only recommended in the first few hours of symptoms. For example, patients are only candidates for clot-busting medications known as TPA for a small window of time, just a few hours, so get to your local ER as soon as you recognize symptoms. Although new guidelines for other forms of clot removal have recently widened the recommended time of treatment, it is still best practice to get immediate medical attention when stroke is suspected. For more Herald Health and Wellness reports, visit the CapeMay-County-Herald.com and click the Lifestyle tab. This health video has been brought to you by the Cape Regional Health System. For more information on services and for a healthier life, call 609-463-CAPE.